What if the most impactful medical careers aren't the most traditional ones?
And I think I remember being on my first assignment in Lebanon. And I remember thinking, this is why I did medicine. This is what I want to be doing.
Don't forget to subscribe wherever you get your podcasts and follow us on YouTube and Spotify to see the interview in full.
So today's guest has designed a medical career full of purpose, courage and freedom. Dr. Justine Cain joins us today to talk about her diverse medical career, which has led her to some of her most important work yet. Welcome to It Takes Heart.
Thank you very much.
So Justine, can I ask, before we even get into your career, what inspired you to take on a career in healthcare? Was there something from when you were little? Was it what you always wanted to be?
I think yes and no.
Yeah.
I think I really enjoyed the sciences at school, and then in high school enjoyed legal studies, and so I ended up doing science and law as my undergrad, and worked in the government for a couple of years. On Torres Strait fisheries, which was a little bit different. And then from there I thought, no, I think I want to try and get into medicine, and so sat the GAMSAT and went through that process and got into medicine and absolutely loved it. I just loved the content, I loved the people, I loved everything about it. I loved that real human-to-human nature of medicine, I think. And I think in the back of my mind, yes, I always wanted to do it, but it was a bit of a windy path to get there. And I think, I look back now and, that I've had some of the best experiences by having that path and taking that journey that wasn't, I suppose, the traditional journey to medicine. And I think from there it's been this path of figuring out what to do within medicine as well. So it's the decision to do med, but then within medicine there's so many different opportunities and different paths that you can follow and change that path as well along the way, which is kind of what I think I've done a little bit of as well.
Maybe talk us through a little bit of that career, because you're right, there's so many choices in medicine. It's not just I'm going to be a doctor.
A linear path to it.
Yeah. So where has that taken you?
I did my internship up in Townsville. And that was a really interesting experience. I was able to go up to Palm Island and do some work up there.
Did you choose that internship location after you'd been up in the Cape, or was it?
No. So how it worked at the time was that it was a random ballot, so for particular hospitals. So some hospitals get undersubscribed, some are oversubscribed, so there's a random ballot. And I was planning to go to the Gold Coast, that's where I trained, and I got randomly balloted out to go to Townsville, which was actually...
How did it feel in the moment?
I think in the moment it was... I didn't expect that, but you got to roll with it and go with it, and I think it was an amazing opportunity to go further north to see more tropical disease and certainly some diseases that I hadn't seen before or come across, some opportunities to work in First Nations healthcare as well. So I was up there for a year, and then I came back to the Gold Coast and completed 2 years of residency on the Gold Coast. And it was during that time a lot of people were very aware of what specialty they wanted to do, and there was a lot of pressure, I think, to choose a medical specialty. So people sort of, doing their masters, or they were doing research, and they were really working towards a specialty, and I had no idea what specialty I wanted to do. I liked a little bit of everything. So so I did what responsible adults do, and I took a year off and I went backpacking around the world.
I was like, just go away for a bit.
That's pretty much what I did. I was a bit too old to call it a gap year, so I called it a sabbatical. And did a little bit of volunteer work in Mexico, but I just predominantly backpacked around. And then I came back and started general practice training. I thought that was a really nice balance of a bit of everything in medicine, because you do really see the weird, the wonderful, and you see little bits of everything. So I thought that would be a good fit for me. So I did the GP training which was a couple of years. And then I sort of gravitated more towards First Nations healthcare again, because I was really missing working as part of a team. And I think that's something that I didn't quite consider when you're looking at a specialty. It's sort of looking at the content and what you will be doing day to day. But I think for me, I really love working as part of a bigger team, and I was missing the emergency department because I'd done quite a bit of work in emergency departments. So
it's interesting, isn't it, when you probably don't consider as a GP, you're sitting in a room on your own. Obviously, you're seeing the patients, and that's the interaction. But as part of collaboration of a team, it must be quite solo.
That's what it felt like at times. So very busy during the day, seeing many patients. But often, if when you finally did get something to eat or grab a drink of water, and you didn't cross paths with your colleagues, it felt like you didn't even see your colleagues all day. So I actually worked in a Aboriginal medical service, and that felt much more like part of a team. I was able to work with the nurses, the health workers, allied health, so I really enjoyed that.
Was that here in Brisbane?
Yeah, up in Northgate. So I really enjoyed that, but as I said, I was sort of missing the emergency department, so went back into doing some emergency medicine before then applying for MSF, so Medicine Sans Frontières.
So I was going to say, what does MSF stand for?
Medicine Sans Frontières, or
would you
MSF.
like to say that?
No.
I know. I don't even know if my French is that good.
You just said it so beautifully.
Say it really quickly and
Medicine
hope for the
Sans
best.
Frontières, was that about close?
Or Doctors Without Borders.
Doctors Without
That's
Borders.
the translation.
There you go. Let's just roll with that.
So that's an international humanitarian medical organisation. So it was founded over 50 years ago.
How did you hear about it?
So I heard about it as a medical student. So I think
that's a long time then from, if you think about that little moment.
Yeah, absolutely. I think it sort of planted that seed in the back of my mind, hearing another doctor talk about their experiences. And I remember they were based in Chad, in Africa, and just hearing the work that they were doing and contributing to. And I thought, okay, this is something I want to keep in the back of my mind for when I feel that I'm ready. And so I think that was as I was weaving my way around in various areas in general practice and emergency medicine and different areas in Queensland, up in Northern Territory, doing some locum work around the place as well. I think that it was in 2019 that I felt that I had a good skill set that I could actually provide some value to the organisation, and that's when I first applied.
So can I just ask then, you said when you were ready, what are this, and it's probably now even more so having done the work, what is the skill sets that are so valuable and that someone really needs to get, or is there skill sets too that you thought you needed that actually you didn't, and there was others that you'd underestimated?
So I think I was sort of considering it as technically ready, I suppose. But again, it's that it's not just the technical skill. I think the things that were useful for me was that I'd travelled a lot, that I'd been away from home, that I'd been away from creature comforts of home. I think that it was really important to work in low resource settings, particularly in rural and regional areas. I think that it was useful to have started to do some studies around tropical medicine and public health. That was very useful. So I think they were probably why I felt that I was ready. But again, looking back, I don't know if you're ever really ready. But it's interesting that probably, it's not just technically ready, but you have to be ready in other aspects of your life.
I imagine personally ready. You have to, how long do you have to go for? Can you talk to us about where you've been? How long do you have to go for? Because even that from a personal level when does that factor into life?
Yeah. So I think, being technically ready, but you're absolutely right. I think being personally ready, financially ready as well. So So all of those factors, because for the first assignment that I went on was for 9 months. So they do ask for a minimum of 9 to 12 months for your first assignment. That depends a little bit on what you're doing when you go there. So for if you're a surgeon, for example, it might be 3 months. But for me as a medical doctor, then it was a requirement for 9 to 12 months as the first assignment. So
it's a long time.
It's a long commitment.
Why do you think they have that longer commitment up front?
I think it's really to get a good sense for the work that you're doing and to realise that, just because of how I do something here in Australia might not be the way that it's done in another context. And so it really takes that time to learn the context, to learn about the organisation, to really work as part of that team, to improve things or change things or support in different ways. And I think that's the important thing, that you don't go in there on a day one, change how everything's done, because it might be done that way because of a number of reasons that you don't know about. So I think for the first time that you're there, having that time to really settle in and figure out the ropes, I suppose, of how everything works.
And after that initial stint, what's the minimum expectation then for your further locums?
So if you go as an emergency project, it's usually less, so it can be a couple of months. But you can also go for several years in particular positions as well. So there is a lot of flexibility.
And these are paid positions, not volunteer positions?
Yeah, so it is a paid position, paid quite a bit less than what you would be paid here in Australia. But I guess for me, it wasn't going for the money. It was, I'm incredibly privileged that I can work here, save my money, and then go away with MSF and get paid. But, you get paid a living allowance, and you're not paying for all of those things that you pay for here.
And so when you talked about having the skills that were required to be ready, what you didn't really touch on there was the emergency skills, necessarily more about the tropical medicine and the public health. I guess people might assume that when you go, it's all, high trauma and that's the big set. But is that not the case? Like, where have you been and what was the work that you did? And what was the environment like?
Yeah, I think it's a really important question, because I think there's a lot of assumptions about, what people see MSF doing and assume it's all, war-torn conflicts or
news and things.
Hospitals and trauma related. I think that's what I found really interesting with MSF, that it does work on that front line of emergency medicine, but it also works on a whole range of other things. So for my first assignment was to Lebanon, and I was working in primary healthcare. So we had 4 standalone primary healthcare clinics, and they were amazing. So patients would come in, it was all free of charge. It was predominantly Palestinian and Syrian refugees, but also vulnerable Lebanese, and they would come to the clinic, they would be triaged by our nurses, and then if they had one of the conditions that we could treat, and because we were primary healthcare, we were predominantly focused on NCD or non-communicable diseases, and that was diabetes, so type 1 and 2, and gestational diabetes, hypertension, asthma, COPD, epilepsy, kidney disease. So we had sort of our list of conditions we could treat, and then they would come into the clinic. They would have a set of vital signs done. We had point of care testing, so little blood test where we could see what their sugars were doing, what their electrolytes were, what their kidney function was, and then they would see a doctor. The doctor would examine them, and then if they needed medication, prescribe medication, and we had an on-site pharmacy that would dispense all of the medication. And then we also had social workers that could help with the social aspects. We had mental health team, psychologists that were available. We had education sessions in terms of lifestyle changes and modification, which we know is really important for managing chronic disease. So it was this whole sort of package of care that people could have when they came into the clinic. And then they would leave with their medication, and then we would see them in 3 or 6 months' time. So it wasn't your hospital, trauma and emergency. But what's really interesting is that in chronic disease like diabetes, for example, or type 1 diabetes, people are reliant on insulin.
Yeah.
And if they have to, to flee an area, if they have to move, if they're living in a tent, if they don't have their insulin, then that's life-threatening. So even though it's not what you think of when you think of trauma, it's still absolutely a medical emergency for these people. And so same with chronic disease, that we're trying really hard to, mitigate those risk factors that are going to lead to needing dialysis or an amputation or something of that nature. So it's more of a longer game, I think, but it's still just as important. And so that was actually my first assignment within Lebanon, and I was there for about 10 months in total.
What was it like when you were there? How do you live over there? What was the rest of life like?
Life like,
yeah.
Do you all live together or?
Yeah, so, and this particular assignment, so it was based in the Becker Valley, and I guess I wanted to say now is how horrible it is, things going on in Lebanon at the moment, and thinking so much of my friends and colleagues over there. We were based in the Becker Valley, which is in the Syrian border, and so we had a flat, and it was a shared flat, so we lived with your colleagues, so living and working with your colleagues. You have your own bedroom, you may share a bathroom. We would usually eat dinner together, and then because we had the 4 clinics, we might not all be at the same clinic on a particular day. So we have MSF driver that drives you to various clinics, and I think one of the most amazing things is that you meet people from all around the world. So your colleagues are from Kenya, Nigeria, from Canada, from Japan. You have such variety of people that you meet, and I think that's really amazing because you get to work with so many incredible people based in Lebanon. And hear their stories and the experiences that they've had, and you're contributing to that, and then you also get to live and work with people that you might never cross paths with, and so that's really interesting as well, and I really enjoyed that aspect. I think that's when we're talking about being prepared, I think that's one thing that you need to be mindful of as well, that you're often living in shared accommodation, you're living and working with your colleagues, but I've only found it really positive and really enjoyed that aspect. I think it's added value to my experience, not taken anything away.
There must be such a shared sense of that camaraderie, and everyone's
shared
coming
experience.
there for that shared purpose.
I guess that's
from all
what's
over the world.
interesting. That's what I missed at times when I was working in general practice, and so I think that's why I sort of gravitated towards working and you do really feel like you're part of a big team, because we can't do what we're doing in the clinic if you don't have running water or toilets that flush, or you're working with your pharmacist to make sure that you have medications available, you're working with your logistics team to make sure that the facility is operational, so you are really working as part of a bigger team. And we're working in the field, and then that's supported by people at the country level who might be more sort of working overarching, HR, finance, advocacy, those aspects, and then that's linked in with the operational centres, which are scattered around the world, predominantly in Europe. So it's this massive team that's all working together to really help people on the ground and provide support. And that was really exciting to be just a very small part of that larger team.
It sounds like you felt very supported from all the organisations, I guess, you can do this with. It sounds like very well organised, and you felt very secure there. Where else have you been?
So that was in 2020 that I was in Lebanon.
COVID?
Yeah, that little thing COVID happened. So that was actually quite interesting too, because again, very unexpected. I left Australia just as we were starting to hear about COVID, and then it hit, and then of course it hit hard, and airports were closed, and so I wasn't able to come home even if I wanted to,
Right.
but I was very comfortable to stay there. That's what I really felt like I wanted to help and support in that context. But it really changed things a little bit for me, because then I was starting to support in terms of how do we manage COVID in our clinics, because our patients are very vulnerable to COVID, and this was before vaccination.
Yes. And it was so
this was
frightening
before
at the
rapid
time.
testing
Yeah.
and trying to organise how to make sure our staff are safe, our patients are safe. So it was a really interesting time working within those clinics during COVID. And so that was 2020, and I came home around November of 2020 and had my hotel quarantine.
Yes.
And then the following year I went to India. So that was an emergency assignment,
Okay.
and that was during the second wave that happened and really hit.
That's right.
Yeah.
Yeah.
Hit hard. And
So how was that different going into an emergency assignment?
I think it was different that I knew it would be a lot shorter. So it was really for a couple of months. And, you know, I expected, rather than going into a really well-established project that had been there for several years, that this was a new project. So MSF was already based in Mumbai. They had a great project working on TB, tuberculosis and HIV. So they had a project already established, and then they provided support for COVID management. So it was at the BKC Jumbo Centre, which is this amazing 1,000 bed tent that was created that had ICU and oxygen capacity, because that was the time when we were seeing things where, you know, people were running out of oxygen, and they, you know, they weren't having access to that basic level of healthcare. So it was this incredible thing that was done in that area with the creation of this jumbo tent. And so MSF was supporting the Ministry of Health in providing care for patients with severe COVID. So I was going there as the medical activities manager, so supporting the team in terms of the medical activities, and it was quite a large team of doctors and nurses and anaesthetic technicians and social workers and psychologists, and our project was to work within this jumbo centre, but it didn't quite work out like that, which was quite interesting.
How so?
So it was monsoon season in India, and the tent, so we were working the project, and then there was flooding that happened. So then the patients sort of were all redistributed to various hospitals, and then we pivoted or changed what the project was to then really work on health promotion and community awareness and engagement. So I think that was one thing. We're talking about the skills in MSF, and it's expect the unexpected, and that ability to really go, okay,
Think on your
there's
feet.
nothing that we can do to change this, and this was not what I was expecting to do. I thought I'd have 3 months working in a tent. But then it was really fascinating. So we then sort of shifted towards training and, as I said, community promotion and education. So we had loudspeakers on the little tuk-tuks, and we'd drive around giving information just around, you know, minimising spread, support for vaccination.
Because that was a wild time. Like, I can't even imagine what that was like there. And just thinking about your family here, you know, we were all, okay, you go to the supermarket, not you. And you're going, I'm going to work in this COVID
emergency
hospital. I'm going to coordinate all of the...
And the news was saying at the time, like, India, like, that second wave looked terrible.
And then throwing monsoons into it and everything being destroyed. Like, how do
your family and friends reconcile that work? Because you see, like, you know what you're going into, I imagine. How do they feel?
I think it's tricky for them, to be honest. I think it is a challenge. I think as I've gotten older, I've perhaps been a bit more mindful of that. I think that, you know, in my mind, as I said to you, I wanted to do MSF work since I was a med student. So it was this long time of really working to this point to be able to do it. So I think my family and friends know how important it is to me and how much it means to me. I think it's also much harder for them than it is for me, because I can see what it's like on the ground. I know how I feel about a particular situation or setting, I've felt safe. I know it's a lot harder for them. I think we're lucky now with technology, and I think that's a big component. Just making sure that you keep in touch and you send messages, video calls. Make sure, that I'm, I guess, being understanding that it is difficult being back home and not knowing what's going on in those areas. So,
because I think the news can, sometimes overplay as well. And
absolutely. I think sometimes the time difference helps a little bit. I was there in 2020 when the Beirut blast explosion occurred, and even though I was in the Becker Valley, I was able to just immediately let friends and family know I was safe, I was okay. I think just communication is key, and I think it is really challenging for friends and family, but I think my friends and family know how much this means to me and how important it is, and so they're supportive. But yes, I think they do worry, of course.
As much as this is your passion, clearly, have you had moments where you have been quite scared, or something has happened where you felt, whether it is that explosion or something has happened where you're like, feel a bit uncomfortable now?
Not really, maybe.
No,
maybe
how wonderful.
Do you choose the locate, do you get an assignment put to you and you can look and go yes or no? Have you gone to places where there's active conflict?
So, yes, you do get a choice. So how it works is, so when I applied, it's sort of a written application and then an interview. And so then you have to fill in your technical skills. And then what they do is the HR team will match you with a suitable project. And then they send you the briefing documents and some overview of the project. And then you can decide whether that is a project for you or not. So there's no obligation that you have to go, and I think that's really important. It gives you that autonomy to say, no, that's not quite right for me at this time. They do say if you're saying that about every project that's offered, you need to actually step back and realise, is this the right choice for you? Because you're going to these contexts accepting a degree of danger. I think that MSF is fantastic at mitigating that as best they can, and so in answer to your question, of why I've not really felt unsafe, is that I do think that MSF take security very, very seriously. And, we have rules put on us when we are in those contexts, that there's areas we can't go to, or there's things that we can't do, or you've got to follow those security rules. I think it just highlights how much time and effort MSF actually put into ensuring that their staff are safe. And so I've not really felt too frightened. I acknowledge that, I've been to Lebanon, I've been to India, but there are contexts that would be more dangerous. So maybe I'll answer that question differently depending on where I go to next. But I think I take a bit of a pragmatic approach that, no one knows what's around the corner, and yes, you're putting yourself in more dangerous situations, but at times you're being so supported by security protocols that you probably aren't at home, and so I've not felt unsafe at any time. But it is definitely a part of it, of knowing that things could escalate, and if that were the case, there's always evacuation options that MSF has, and I think that's what can be really challenging, because you're working with a whole lot of locally hired staff, and that's their home, and they wouldn't have the benefit of being able to evacuate if needs be, and so I think that's the challenge as well of realising that these, your colleagues become your friends and family when you're away from your friends and family back home. So understanding the challenges that exist in those contexts.
So how does your work at MSF then work in with your work back home?
that has been
what
a
does
big
your
challenge.
career look like since 2019?
Yeah. And when we were saying, was I ready? And I think that was another interesting thing with general practice, is that I also found a little bit harder to go away for long periods of time as a GP. I think that your patients do expect you to be available, and when they get comfortable with you as their GP, it can be really upsetting for some patients when you leave. And so I guess that's what I also factored in terms of what can I do to still do the work that I want to do and be able to afford to go over and work with MSF. And that's how I sort of moved a bit more into emergency medicine and doing locum work. And then I sort of deviated a little bit into medical education, so working with, I guess, developing more of this portfolio of doing a little bit of different things. Most recently I've been working in urgent care, and so that's a really great combination of a bit of general practice and a bit of emergency department. And because you don't have that continuity of care with your patients, you're able to go away for longer periods of time without it being as disruptive. So I went back to Lebanon last year, and my employer was very, very nice and gave me 6 months leave without pay for me to be able to go over and do some more work with MSF. So it's a bit of a balance. I would say that being a doctor, you know, with a broad skill set and being quite employable, that does give me a lot of privilege to do to go away for 6 months and then come back and still have work. It might be more difficult in other careers, but certainly I think that having a supportive employer is very useful, and the ability to do locum work and things has been very helpful as well.
Yeah, I think that's a real benefit, isn't it? And it sounds like you talked a little bit about doing some locum work in NT and things like that. I guess if someone is listening and they're thinking, oh, I've always wanted to do this, but maybe they don't have the skills as yet, like what advice can you give them to see what steps can they take to make sure they do? Is it the adaptability of doing locum work in remote locations here in Australia? Is it working in emergency or primary care? What advice would you give?
I think for me, the first thing would be that even though it's called Doctors Without Borders, it doesn't, as an organisation, just recruit doctors. And I think that's one of the big misconceptions, that, people think they have to be a doctor in order to work for the organisation. So, it's not just doctors, it's pharmacists, it's psychologists, it's, our logistics team, it's HR, it's finance. There's such a large group of people that are involved. Allied health. So a really broad range of people that they're looking for. So that would be the first thing. You don't just have to be a doctor. Yes. There's lots of profiles that they look for. I think the second thing would be having a look at the website. So the MSF website has, who are we looking for? And that I found that very useful because it goes through an essential criteria and a desirable criteria, and it can really let you think, okay, do I tick off some of those things? What sort of things might make me more employable for something like MSF? I think generally if you're well-travelled, if you've worked in low-resource settings, that's helpful. If you speak another language, that's helpful. But again, I mean, I'm not a HR person, but I don't think, you need to tick every single box. I think, those skills that we spoke about in terms of flexibility and adaptability are just as important as the technical skills as well, because things can shift and change very quickly in humanitarian contexts. So I think the website's a really good and useful start. And I think don't be deterred by the 9 to 12 months initial commitment. I think it does depend a little bit on your career profile, and if you're working as a obstetrician or an anaesthetist or a surgeon, something of that nature, then MSF certainly would be supportive of a shorter initial project or assignment. don't quote me on that. I guess I'm not HR, but that's what but certainly I think there is that flexibility because people know that it is hard to take 9 months off your job and your life back home. So I think, but getting in a good position to know that, things shift and change when you work for MSF and that it is important to, I guess, not just be ready technically, but ready in terms of all of those other skills that we spoke about.
Justine, when you reflect back on your career and you think to, medical school when everyone had that specialty in mind and then you had to take your sabbatical, with where you are now, collecting like a portfolio of experiences, how do you feel looking back on?
Yeah, I mean, I still don't know what I want to do when I grow
you're halfway
up.
Through, right?
I love that. But no, I'm in a much better place about it, and I think that I would love to share that as well. That I think there's so much pressure when you just start. You need to select a specialty
haven't figured out.
Go to the right hospital. Go to the right specialty.
Talk to the right people. Do this, do that. And the reality is that if you choose a specialty that's not suitable for you, then you've invested a lot of time, a lot of effort going down the wrong path. So it's better to take a bit of time to realise that the specialty will still be there in a few years' time, and that in medicine there's no substitute for that experience that you gain. So, I look back now and I think that I was very stressed at the time of not knowing, oh my gosh, what am I going to do? But now I'm much more relaxed about that because, I think that, people, I guess, when I talk to people, they say, what are you up to now? And, it's a little bit of an atypical path, but it's a path that's led me down to many amazing experiences and different experiences and just sort of saying yes to stuff and giving it a go. And I'm still figuring out that path, and so who knows what the next 10 or 20 years will be like, trying different things. But I would say that, I'm proud now looking back that I've just done my own thing. But it has come with those challenges because you are sort of going slightly differently to what a lot of people do, which is pick a specialty, go through that specialty training pathway, and then work as a specialist in that area for decades. So all are valid. Mine's just been a little bit different to that.
It's great to hear that too, because I guess one of the reasons we wanted to have the podcast too is to share stories like this so that, someone in medical school might hear that and go, it's actually okay. I'm not feeling like I am going to spend decades in this one specialty, or I didn't know this kind of work existed, and how would I navigate now a few years down the line to get there? So it's great to hear stories like yours.
And even to now to say, I'm not sure what's next.
I'm there, and I'm still working.
I guess what we could guarantee is it's going to be varied.
Yeah,
and
absolutely.
It's going to have some real interest pieces, and you can see how passionate you are about the work that you do and that you've done, which is beautiful to see.
I was going to ask that. Do you feel as like the sense of satisfaction and purpose? Do you think it feels stronger because you've been able to do all of these different things?
Yeah, I think so. I think. As I said, I loved medicine and I loved med school, and then, when you're working as a junior doctor, there's challenges there in terms of, is this what I want to be doing? Have I made the right choice? Because I had a career before I went into medicine. And I think I remember being on my first assignment in Lebanon. I remember thinking, this is why I did medicine. This is what I want to be doing. And I decided I was just going to do back-to-back MSF assignments. And then it was really interesting when I came home, I realised that, it's probably wasn't financially able to just do back-to-back assignments. So then that's when I started to shift to say, okay, well, how can I create this life where I can go away every couple of years and do some work with MSF. I think that gives me some purpose to sort of try and align things that enable me to be able to go away with them again. And so I've completed 3 assignments now, and I'm definitely excited for the next one and the next one and the next one, because I think there's so much need in the world if you look around in terms of all the humanitarian crises that sadly feel like they're getting worse rather than better, and so there's great need there. So I want to keep working towards being able to provide that little bit of support that I can.
Justine, you've worked locally and globally. Is there one common theme that you see that you think, if we could just fix that, it would lead to just better health outcomes globally? Or is that just too big?
I think if there was one thing that could fix everything, it would be fixed. I mean, I think there's many
impact.
social determinants of health, and I think studying tropical medicine and public health, and you just realise how complex and how complicated it is, and that it's not just a simple, if we fix this, that will fix everything. I think that, going back to some more basics of international humanitarian law would be a really great start in terms of just realising we're all human beings. Bless you.
It's your first sneeze in a podcast.
Sorry.
That's okay. But yeah, we're all human beings, and treating each other fairly and respectfully, and there are a lot of the principles of MSF, I suppose, and I think working towards that. I think ensuring, just basic healthcare at the end of the day, that people have access to water would make a huge difference globally. Have access to appropriate sanitation would make a huge difference globally. I think for me, it's not necessarily the amazing, technical and fancy aspects. It's really just going back to the basics. And I think as well of, ensuring that people have their autonomy over their healthcare as well, and people being able to make choices for their own healthcare and being supported in those choices is really important as well. So but no simple fix,
but it's interesting, like it is just the basics, and that was probably more what I was thinking is, when you're looking globally, like it might be those, it's not necessarily the tech and all of those things, it's just the basics.
And good people who want to do this great work. I think it's making sure that we've got people still attracted to work in healthcare and wanting to do things like this.
And people on the ground, the locally hired staff that are there, that living in these contexts, and the work they do is just incredible. And so, supporting that as well, I think is really important.
Yeah, community really shines through to me when you speak of everywhere that you've been, of really building and feeling a part of a community.
Absolutely.
Yeah, that's really, really clear. So with your episode, CMR will always make a donation to a charity of your choice. Where can we donate to?
Oh, no surprises here. So, yes, I would love, that's very, very kind. But MSF, I think, for people listening that can't, or are not in a position that they can, work for MSF, there's obviously, I see firsthand where the donation goes, and the work that is getting done in contexts that are really challenging and really difficult. And donation to MSF would be amazing. So thank you.
Thank you so much, Justine, for your time today. It's just been incredible to hear your story, and I think you're right now, the world is in a really tricky place at the moment, and to be able to shine a light on the work that MSF does, and hopefully encourage more incredible people like yourself to go and volunteer and support and work in these places is amazing. And equally, just for the medical students, it's so inspirational to hear about an atypical portfolio career.
Atypical portfolio career, I love it.
There you go. We've started a trend. But like how inspiring, and as someone who, I think, when I started my career in healthcare and occupational therapy, I didn't end up following a typical career, and I definitely am very passionate about hearing these stories and inspiring others to follow and say yes to all of those things that present, because you just never know where you think you're going and where you end up. It's where you're meant to be. So thank you.
No, thank you so much for having me this morning.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.